Welcome to LPN LaunchPad's quick review of the cardiac assessment. This quick review covers heart function, auscultation techniques, circulatory assessment, and key clinical indicators, providing an overview of the essential components required to evaluate cardiac status. Early detection of heart disease, heart failure, and circulatory collapse remains crucial for patient outcomes. Cardiac assessment guides interventions for arrhythmias, murmurs, and shock. The assessment employs three methods. Inspection involves visual evaluation of the patient. Palpation assesses pulse strength, detects thrills, and evaluates heaves. And auscultation listens for heart sounds, murmurs, and other abnormalities. Direct evaluation of these methods supports clinical decision making. Inspect the patient for cyanosis, which indicates poor oxygenation or congenital heart defects. Evaluate the patient for pallor, which may suggest anemia or poor circulation. Observe the patient for peripheral edema, which often suggests right-sided heart failure. Each sign serves as a critical indicator of the patient's circulatory status. Define jugular venous distension as the visible bulging of the jugular vein resulting from increased venous pressure. Position the patient at a 30 to 45-degree angle during the evaluation. The jugular vein should flatten when the patient is upright. Persistent distension of the jugular vein indicates right-sided heart failure or increased central venous pressure. Auscultate the apical pulse at the fifth intercostal space along the mid-clavicular line. Record a heart rate between 60 and 100 beats per minute as normal. Identify irregular rhythms, such as atrial fibrillation, and note any pulse deficit when the apical pulse does not match the radial pulse. Direct evaluation of these parameters is essential for diagnosing cardiac abnormalities. Examine bilateral pulses, including the radial, brachial, femoral, popliteal, dorsalis pedis, and posterior tibial pulses. Grade pulse strength as follows. A grade of 0 indicates an absent pulse. A grade of 1 indicates a weak, thready pulse. A grade of 2 indicates a normal pulse. A grade of 3 indicates a strong pulse. And a grade of 4 indicates a bounding pulse, which may occur with fluid overload or hypertension. Recording these observations aids in determining the patient's circulatory integrity. Perform the capillary refill test by applying pressure to the nail beds and timing the return of normal color. A normal capillary refill occurs in less than 3 seconds. A delayed capillary refill, lasting more than 3 to 5 seconds, suggests poor circulation, shock, dehydration, or vascular disease. The test provides a rapid evaluation of peripheral perfusion. Measure blood pressure while the patient is seated, with feet flat on the floor and relaxed. Use an appropriately sized cuff, because a too small cuff produces falsely high readings, whereas a too large cuff produces falsely low readings. Measure blood pressure in both arms, initially to establish a reliable baseline. Classify blood pressure readings as follows. A normal reading is less than 120 over 80 millimeters of mercury. An elevated reading is 120 to 129 over less than 80 millimeters of mercury. Hypertension. Stage 1 is 130 to 139 over 80 to 89 millimeters of mercury. Hypertension stage 2 is 140 over 90 millimeters of mercury. 140/90 millimeters of mercury or higher. And a hypertensive crisis is above 180/120 millimeters of mercury. These classifications direct appropriate clinical interventions. Define orthostatic hypotension as a drop in systolic blood pressure of 20 millimeters of mercury or more, or a drop in diastolic blood pressure of 10 millimeters of mercury or more within 3 minutes of standing. Recognize symptoms such as dizziness, fainting, and weakness. Identify common causes, including dehydration, blood loss, and the effects of medications. Assess the patient by measuring blood pressure in the lying, sitting, and standing positions. Auscultate the heart to identify normal heart sounds. S1, known as lub, results from the closure of the mitral and tricuspid valves at the start of systole. S2, known as dub, results from the closure of the aortic and pulmonic valves at the end of the systole. These sounds establish the baseline for normal cardiac function. Listen for abnormal heart sounds. S3, or a ventricular gallop, may serve as an early sign of heart failure. S4, or an atrial gallop, indicates stiff ventricles, often associated with hypertension. The presence of these sounds suggests pathology and guides further evaluation. Identifying the characteristics of murmurs can help differentiate them. Aortic stenosis, caused by a narrowed valve, produces a harsh systolic murmur. Mitral regurgitation, caused by a valve failing to close completely, produces a blowing murmur. Aortic regurgitation, on the other hand, produces a diastolic murmur when blood leaks back into the left ventricle. Understanding the types of murmurs can assist in diagnosing specific cardiac conditions. Summarize the key components of cardiac assessment. Inspection involves evaluating skin color, breathing patterns, and JVD. Palpation involves assessing pulse strength, rhythm, and capillary refill. Auscultation focuses on heart sounds and murmurs. And blood pressure measurement includes evaluation for hypertension, hypotension, and orthostatic changes. Integrate these findings to form a comprehensive cardiac evaluation. Adopt effective strategies to prepare for cardiac-related NCLEX questions. Focus on understanding cardiac physiology, mastering heart sounds, and practicing blood pressure interpretation. These study techniques enhance both exam performance and clinical competence. Review heart anatomy and blood flow. Familiarize with the functions of the SA node, AV node, bundle of His, and Purkinje fibers. Understand the concepts of preload, afterload, and cardiac output. Direct knowledge of these elements forms the foundation of cardiac physiology. Differentiate between normal and abnormal heart sounds. Recognize that S1 and S2 represent normal heart function, while S3 and S4 indicate potential pathology associated with heart failure and hypertension. Learn to distinguish between systolic and diastolic murmurs to diagnose specific conditions accurately. Study blood pressure classifications, including normal, elevated, hypertension stages 1 and 2, and hypertensive crisis. Develop an understanding of orthostatic hypotension and its assessment. Regular practice in interpreting blood pressure readings is essential for clinical decision making. Consider the question: which blood pressure reading would be classified as stage 1 hypertension? Option A, 118/76 millimeters of mercury. Option B, 124/78 millimeters of mercury. Option C, 132/84 millimeters of mercury. Option D, 148/96 millimeters of mercury. Selecting the correct answer by recalling the criteria for stage 1 hypertension directly. The correct answer is option C, 132/84 millimeters of mercury. Stage 1 hypertension is a systolic pressure between 130 and 139 millimeters of mercury, or a diastolic pressure between 80 and 89 millimeters of mercury. Accurate blood pressure classification supports appropriate management. Consider the following question. A nurse assesses a patient's jugular vein. Which finding is most concerning? Option A, JVD visible at 10 degrees in a patient lying flat. Option B, JVD disappears at 45 degrees in a sitting position. Option C, JVD remains distended at 45 degrees. Option D, JVD visible when the patient is standing upright. Analyze the implications of each observation in terms of cardiac function. The correct answer is option C. The JVD remains distended at 45 degrees. Persistent jugular venous distension at a 30 to 45 degree angle indicates right-sided heart failure or increased central venous pressure, warranting further evaluation. Consider the following question. Which murmur is most concerning? Option A, a systolic murmur heard in a young athlete. Option B, a diastolic murmur with a bounding pulse. Option C, a high-pitched systolic murmur in the mitral area. Option D, a soft systolic murmur heard during deep inspiration. Evaluate the clinical significance of each murmur type to determine the most concerning finding. The correct answer is option B, a diastolic murmur with a bounding pulse. Diastolic murmurs invariably indicate pathology, and a bounding pulse suggests aortic regurgitation, which requires prompt medical attention. Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.